we've seen over the last 4 to 5 years, we've seen a trend towards level funding. And I think reference-based pricing can be one of the things that can move us forward in the level funded process and program. So private insurers pay nearly double Medicare rates for hospital services, and that ranges from 141% on up to 259% across a number of studies that I looked at. According to the Kaiser Family Foundation, April 15, 2020, the difference between private insurance and Medicare rates is greater for outpatient services at a hospital, 264% versus 189% of Medicare rates. So we're doing our reference-based pricing here at OptiMed at 150% of Medicare versus a PPO being 200 to 265% of Medicare. So what can we expect? Let's be realistic now in what we can expect. Reference-based pricing system, employers can expect a minimum of 10 to 15% savings. Realistic, conservative. That's what we want to be. We want to under-promise and over-deliver for you. Those savings are largely just changing to reference-based pricing. We can say that much more. The reference-based pricing model flattens year-over-year trend because you are renewing, because Medicare doesn't always raise their rates 10, 15% a year like many physician offices do. Let's address this elephant in the room. The biggest question in everybody's mind is, what about balanced billing? Here's how we're going to deal with balanced billing. 90% plus really of providers are accepting that reference-based price of 150% of Medicare. So when we tell providers we're at 150% of Medicare, they're like, fine, we'll take that. It's some of these other reference-based pricing plans that are trying to trim it even lower, and that's where they're getting a lot of their kickback from. Another 7+% of those providers will accept 150 to 200%. So we do have room to negotiate, and we have agreed with our carrier and our repricing partner so that we do have room to negotiate for that 7+%. Now, there are still some of the 1 to 2% of providers that just say, I am not going to work with you. But what we've done is we've partnered with a strategic advisor that has experience, and we have results. And what we're doing is we're trying to limit, and our goal is no balance billing. Our pricing partner is Zealous. They've been in the pricing negotiation with providers for over 20 years. They have over 11 years of providing reference-based pricing solutions in the marketplace. Over 5 million reference-based pricing claims have been repriced. Over 45,000 employees' lives are insured under reference-based pricing programs through Zealous alone. Typical, according to Zealous, is 15 to 25%. So again, I'm promising less than they're promising. They're a full integrated partner. They will do the industry-leading advocacy. So if we have that 7%, we have that 1%, 2% that are resisting the 150% reimbursement, Zealous will be that patient advocate for your clients so that they do not have to do the negotiation. And typically, they never see it. They never know what's going on behind the scene.